שלום, אני דוקטור רות טל-סינגר, מדענית ראשית ב-Global Allergy and Airways Patient Platform.
Good morning. I'm Dr. Ruth Tal-Singer, Chief Scientist of the Global Allergy and Airways Patient Platform, an organization that brings together more than 120 nonprofit patient associations around the world. We work to empower these organizations by sharing our extensive experience in patient-centered research while supporting the development of medicines and medical devices, improving and making treatment more accessible, and also promoting early diagnosis. World Bronchiectasis Day, celebrated each year on July 1st, was created to raise awareness of the disease and support bronchiectasis patients and their families. More than 20 global health organizations dealing with lung diseases joined together under the leadership of an international organizing committee to promote awareness of the disease worldwide. This day marks a global campaign that includes year-round activities focused on advocacy, research, and education with the goal of reducing the burden of the disease. This year marks the third World Bronchiectasis Day, and its main theme is research. As a scientist and researcher for nearly 30 years, I'm grateful to the patients and their families who have helped advance our understanding of the diseases and supported the development of important treatments and prevention strategies for lung diseases. We are pleased to present a webinar that brings together a doctor and a patient. Together, they will help you understand how a patient or a researcher can contribute to local research activities in Israel or to international research. And this will be an idea between us, this exchange of ideas. Professor Michal Shteinberg is an expert in pulmonary medicine, director of the Adult Cystic Fibrosis Project Unit at the Carmel Medical Center, a faculty member and researcher at the Faculty of Medicine of Technion. Professor Shteinberg is a member of the leadership of the European Bronchiectasis Organization in MARC. Ninon Farber is being treated and suffers from bronchiectasis. She's also a research partner of Professor Shteinberg, and together we will discuss the importance of collaborative research to treat this disease. I will start with a question for Michal Shteinberg. What is bronchiectasis? Hello, Ruth and Ninon. Thank you very much for inviting us. I'd like to answer the question, and for that I'm going to show a diagram that I show to all my patients in order to understand what bronchiectasis is. You need to know what the structure of the lungs actually is. And here we see a healthy lung on the left side of the screen, and it has tubes that carry air. They are called bronchi, and they are divided like the root system of a tree. On the right side, we see a lung with bronchiectasis, and the bronchi are distorted. They are wider, more deformed, and often also inflamed. And as a consequence of the accumulated inflammation, mucus accumulates. And with this mucus comes infections. Basically, it's an abnormal structure of the lungs, and we can also see it on a CT scan. We usually diagnose bronchiectasis on a CT scan, and here you see a vertical slice on the left side. A healthy person, as in the CT scan diagram of the left, where you see the airways twisted and contoured, usually patients whose doctor shows them a CT scan will see a horizontal section and not a vertical section. And that is what bronchiectasis looks like on a horizontal section. But bronchiectasis is not just CT scans, there are also symptoms. And patients who we suspect have bronchiectasis are patients who present with cough, a lot of phlegm, recurrent airway infections. Thank you. Now I'm going to ask you, Ninon, how does bronchiectasis manifest itself in you? What symptoms have you had, and at what age did the disease start? Well, first of all, I'm 73 years old, and I was very lucky to come across this study, because for as long as I can remember, since I was a child, I have always suffered from my lungs. No, I can't define. It was pneumonias of all kinds. And every time I started with the disease, which was very frequent, I knew when it started, but I didn't know when it ended. A lot of antibiotics. And I got to the point where I was on antibiotics for several months in a row, and each time a different antibiotic, then it didn't work. So I was very, very infected. In fact, I started when I was 16. The cough was terrible. At that time, there were not the means that exist today. I was born in Uruguay, and it was very basic there. All the time, I had a normal X-ray, and they didn't see the problem. Or maybe it wasn't that developed then, or they didn't know it enough until I was 16 years old, and I started coughing nonstop, just like that. I didn't sleep or anything. I coughed constantly. I had a fever, a lot of fever. I started vomiting blood in quantities. I mean, I woke up, I remember it was 2 days in a row that I was full of blood, and then they treated me a bit differently, and they sent me for a bronchoscopy. And there they saw that the right lung was almost completely gone. And the second lung was also infected, but not to that extent. Then I was operated on, but not for removing the lung. They removed the lobes. What are they called? Like the lower and the middle part of the lung. About a third of the lung remained. That's what I had to manage with. And I thought that was it. While there were difficulties and rehabilitation and all that, it wasn't easy for me. But I thought the disease was over because I didn't get any information about the disease itself. But it came back again and again, and it got worse and worse. I also related that to the change of seasons, to an allergy, to any situation. Only it's not. And the truth is that when I came to Israel in 1976, I continued with the same things, the same kind of antibiotic treatments, sometimes steroids, sometimes antibiotics again, all kinds of Zinat, and as many antibiotics as possible. Each time it was stronger and stronger, and it didn't work. And I was lucky to meet Geffen, Professor Steinberg. And by chance, I mean, I came on my own. I don't know if it was by chance, but I came to her as a therapist or what, I don't remember. My illness was not diagnosed yet. So she sent me, and she made me continue the treatment. And I can really say that since then, I have had some events until I got to the point where I took this new drug, an experimental drug that I took for 1 year. And I can say that since then, I've had no events at all. I can't say that I'm cured because I really know that it doesn't cure me. I don't know exactly what process this medicine does, but I haven't had any more cases. Before, as soon as I had a runny nose, I went straight to high fever and cough and weakness and breathlessness and all that. And today, actually, I'm in the process of treatment, and I'm very quiet. I don't feel like it can just pop up every time all of a sudden at the least glamorous moments of the day. And I really feel in good hands, and happily, after finishing the year of the experiment, I continue with the treatment. Of course, I also do the inhalations although not always twice a day, as Professor Shteinberg recommends. But let's put it this way. I'm in very, very good shape. Thank you. Yes. Thank you. Thank you. Michal, I have a question for you. What treatments are there nowadays for bronchiectasis? Because we heard from Ninon that awareness of the disease did not exist in the past. What are we today? Where were we before? Well, this is really a very important point because I think in the past 10 years, we've been more aware of the disease and we have also learned a lot about how to treat it properly. First of all, it's important to try and determine the reason for the bronchiectasis. Most of the patients don't know what the reason is, why this happens suddenly, especially when there are people whose disease starts at a very young age. Then sometimes there are hereditary genetic causes, and we are trying to find them out. Sometimes there's a treatment that is specific according to the cause, but in most cases, the cause is not found. There's still general treatment, as I showed earlier in the diagram, the bronchi are full of phlegm. On that phlegm, bacteria settle, inflammation is created. So a very important first step in the treatment is to try and clear the lungs or the bronchi from the inside. And this is achieved by a combination of inhalation and respiratory physiotherapy. I mean, the physiotherapy is a very important part of the treatment for bronchiectasis because actually they teach the patients how to do the treatments, how to do the physiotherapy treatments on their own to clear the lungs. And this is something that we recommend patients to do every day or even twice a day, as Ninon said. And it really is something that we recommend to almost everybody. And to that, we add inhalations that soften the phlegm. Some patients also manage with just inhalations or physiotherapy. In the case of recurrent inflammation, we can also add long-term antibiotics, either systemically, orally, or by inhalation. Antibiotics can also be administered by inhalation. And these are the treatments that already exist. They are, on the shelves, any pulmonologist can prescribe them. And what is currently being developed are actually drugs that target the mechanism of inflammation, among them the medicine that Ninon referred to. We know today that bronchiectasis is an infectious disease. It's actually an inflammatory disease, so it's also very important to administer drugs that stop the inflammatory process. There are currently 2 drugs under development, which are drugs that are taken orally and reduce the inflammatory process. And there are other drugs that also target the inflammatory process and are given by subcutaneous injections once every 2 weeks or once a month. But these things are not yet registered. They're still under development. What we do have now is physiotherapy, inhalations, antibiotics. These are things that are very, very good. Patients really already feel an improvement, but there's room for further improvement. And these treatments also require a lot of time to tell the patient to take care for 15 minutes with inhalation, another 15 minutes both in the morning and in the evenings is very limiting. And therefore, the aim is to find treatments that are more effective and less burdensome for the patient's life. Thank you. I think this is what Ninon told us in her story about quality of life, and we really need to do better. As they say in English, we need to do better to improve the quality of life. Ninon, you told us how you moved into clinical research. Could you share with us a little bit about your experiences as a clinical research participant? I only have good words to say because, first of all, I didn't know and nobody knew. It seems to me that nobody knew exactly what it was that I was taking, whether it was a placebo or the actual drug. But based on the results, you could conclude that it was the drug. That was the cure, because I don't think placebo can work that well. And I'm telling you this because of an event I had at least once a month. It was a really shocking thing because I didn't say this, but since the surgery I developed a new bronchiectasis in both lungs. Not that, like I said, I had an expectation that it would be over after the surgery. It didn't happen. And it's really, how can I say, I'm so grateful. I can't thank enough for all of this. It didn't bother me at all. We can say that, I'm in excellent conditions. I mean, and they even paid for the taxi, and taking the morning medication was not difficult at all. It's really very, very easy to take. It requires very little effort, especially when you see the results. I was very disciplined. I confess that I really believed in the ability of the drug as soon as I saw that it really worked. And I would like to point out that they did test me to see if it was genetic. And today I'm undergoing the first genetic test for cystic fibrosis. They did not find that I have this gene, but yes, now they did another genetic test that I don't know exactly why, but it's very, very simple. Whatever they offer me, I will do it. I admit that I'm really addicted to research and also to everything that can help other people, of course. Because I know what suffering is, what it means, how much it has weighed on my life. I loved dancing when I was a child, and I couldn't do anything, sports, anything. I was constantly sick. It's hard. It's hard for a child to grow up like that, but that's it. And there's no one else in my family who suffers from it, fortunately. It didn't appear. The illness appeared only in me. Without people like you, we wouldn't be able to understand what drugs do, and that's really important. The question for Michal is, what measures are taken to ensure the safety of patients that participate in clinical research and to make it easier for them? Well, that's a very good question. Most patients are not like Ninon. They ask me, why participate in the study? Am I a guinea pig? So first of all, when a medicine or a drug reaches the clinical research stage, it means that it has gone through many, many stages to prove both its safety and its efficacy. This means that any research we do with humans must be approved by the Helsinki Commission of the hospital and also the Ministry of Health. And these commissions approve drugs, they approve clinical trials only after it has been determined that the drug is safe to use. Usually, after the experiments, they are first tested on animals and on healthy volunteers, patients, and then on patients, sick patients, to see if the drug is effective. At the beginning, it's tested on few patients, a few sick people, then it's extended in the third stage to many more patients with the disease to prove that the drug is really effective. And basically, each stage requires approval to make sure that the drug is, first of all, safe, that we are not causing harm with our treatment. We do blood tests to look at blood counts, to look at the liver, in pulmonary studies, we also do respiratory functions to look at the effectiveness and, in fact, to move in very, very slow steps. And generally, the average period to approve a drug from the time they invented the substance or discovered it and said, well, maybe it will help, until it's approved for use, it's quite many years, many stages of clinical trials. And just testing a drug in a clinical trial with all the controls that exist over the research, in my opinion, is much safer than going out and buy something in a health food shop that nobody has tested or approved, and the drug didn't go through the same stages of control. And as you said, very true, Ruth, there are no new medicines without research. It's imperative that patients help us to help them and other people. It's really a collaboration between researchers, doctors, and medical staff in general, and patients. And we must work as a team to advance the science and advance the knowledge about this disease called bronchiectasis. Thank you. One last question to Ninon. What would you like to say to people living with bronchiectasis? How would you encourage them? As we heard from Michal while we were talking, how would you encourage them to participate in research? Because not everyone understands the importance of clinical research. Well, first of all, the truth is that I'm among all doctors, and really there have been many, many doctors, both abroad and in Israel. And with Michal, with Professor Shteinberg, I felt very early on that I had a doctor that I trusted. Even when I was sick, her level of care helped me a lot before the research study. So I felt that I had a connection with someone who really listens, really helps, really knows the job completely in terms of how to take care of me. Because that didn't happen to me often. I felt with some doctors that really, I'm not saying they didn't take care of me. Of course, they took care of me, but not in a way that was appropriate to my disease. And I went on. I could have been on the same antibiotic for 3 days and I didn't make any progress. I just ended up with infections, and the whole system was disturbed with diarrhea and so on. It's impossible to take antibiotics in large quantities, strong antibiotics, without the body taking a hit from all directions. And that's what happened to me. First of all, I strongly believe in the processes of medicine. I really have faith in doctors and the help they can give and the knowledge they accumulate over the years. And I highly recommend it to anybody. It's totally worth believing and trying, and there's nothing to lose, because the disease, just living with the disease, it's not that you die, or at least I didn't feel that I was going to die, but I felt a kind of disability that I never knew when it was coming. Suddenly, I felt very well, and after 1 hour, I had 40 degrees, a high fever, and this really changed my life for the better. Especially me. I mean, I'm going to get old soon. I'm already 73. I'm not young. So you can say that the chances of the disease getting better with age seem to be higher now. And on the other hand, I feel much better than before. So I recommend everybody try and believe and follow the instructions as well. It's very important to be very, very disciplined, and the improvement will come. Thank you. Thank you again, because this has really changed my life. Yes. So thank you so much. So grateful. I just want to add something that nowadays awareness is increasing, and like our center, there are other centers in Israel. And in fact, many doctors have been working on this field of bronchiectasis, and many doctors know about it, and knowledge is accumulating. And in fact, one of our functions is also to educate the younger generations, to make them familiar with the disease, which in the past was not so well known. We didn't know much about it. Yes, this awareness is very important. This is what we're trying to do with the World Bronchiectasis Day, to generate this awareness and to encourage people to participate in research and to support patients' participation in clinical research. I don't know how to say it in Hebrew. Nothing about us without us. Nothing about us without taking us into account. I don't know if that's the right expression. Sure, you did. Well, basically, this emphasizes the importance of patients for every process. Every positive process cannot be overcome without patients. It's a collaboration, collaborative, shared decision-making among patients, families, and researchers. So thank you so much. Thank you very much for participating. Thank you for the idea. We really appreciate it. And to those who participated, if you have any questions, of course, you can ask. We have a slide with the email address that you can write to. Let's see if we can share the slide.